Hi, everyone. My name is Cassandra, and for my major project lecture for exercise physiology, I will be discussing exercise-induced pulmonary hemorrhage in horses, also known as EIPH. EIPH is bleeding that occurs from the lungs during exercise, typically strenuous exercise. It is most commonly seen in racing horses such as thoroughbreds and standardbreds. However, it can also occur in horses competing in other sports, such as barrel racing, three-day eventing, and others where horses are intensely exercising for short periods of time. EIPH is not unique to horses and has been reported to occur in greyhounds, camels, and even human athletes. However, limited studies have looked at the prevalence of EIPH in these other species. However, a study was done in greyhounds by Epp et al. 2008. They found that the red blood cells in the BAL fluid increased after a simulated race, but the extent of EIPH in these greyhounds was mild compared to horses. The exact cause of EIPH is still not determined at this point. However, there are several accepted theories about why it does occur. Crisp and Lester 2019 discussed that a well-accepted theory of why EIPH occurs is due to lung blood vessels rupturing in response to high blood pressure and low airway pressure experienced during exercise. Some other theories we discuss in class include that due to locomotion, compression of the chest from the legs causes pressure to be focused into the dorsal caudal section of the lungs. Another thing we discussed was that increased pulmonary capillary pressure occurs during exercise. There are a few different ways to diagnose EIPH. The first one is epistaxis. Epistaxis is where we can visually see blood coming out of the horse's nostrils. Epistaxis rarely occurs, its prevalence being at about 0.25 to 13% in our sprinting horses. The next diagnostic tool is bronchial alveolar lavage, or BAL. BAL is ideally performed 30 to 60 minutes after a race. An endoscope or tube is passed through the nostril and into the lung until it is wedged into a bronchus within the dorsal caudal region of the lung. Then we introduce phosphate buffered saline into the BAL tube. Finally, this fluid is recovered from the BAL to be analyzed. BAL is considered to be the most sensitive diagnostic test for EIPH determination compared to an endoscopic exam. The last diagnostic tool is endoscopic exams. During an endoscopic exam, a video endoscope is inserted into the airways to examine for the presence of EIPH. Once the exam is completed, an EIPH score is given based on a scale of 0 to 4. Several studies that I will talk about during the rest of this presentation utilize the BAL and endoscopic exam. I wanted to discuss epistaxis a little more in detail since it was the original way to diagnose EIPH before we had all these other diagnostic tools available to use. Even though I mentioned in the previous slide that epistaxis is not really prevalent in most sprinting horses, it is more likely to be present in shorter and higher intensity races, steeplechase races versus flat races, older horses, males versus females, and during cooler ambient temperatures. And as you can see in this image here, this is a visual of what epistaxis would look like in a racing horse or a horse in general. Here you can see a table on the left of an EIPH scoring system that was used in a study by Kinch et al. 2017. As you can see, the grades are from 0 to 4, obviously 0 being the less severe where no blood is detected, while a 4 being where we see a lot of blood covering more than 90% of the tracheal surface. And this study that uses the table on the left, we will be discussing in our Moodle discussion. So you will be seeing more from this particular study. The image on the right is from Hagan. This was also in our class lecture where we discussed EIPH. And it just shows a visual of the grades of EIPH using the endoscopic exam. And as we can see here, there's another example of a horse having epistaxis, which is, the visual, actually seeing blood coming out of the nostrils. So here's a video I thought would be interesting to play of an endoscopic exam done on a horse. When they did this endoscopic exam, they classified this horse as a grade 4 bleeder. So obviously pretty severe in terms of our scoring system. And again, I just thought this was interesting to visually see an endoscopic exam in action. Again, I thought this video was really interesting to see. You can see quite a bit of blood in the horse's airway, so I can see why they classified this horse as a grade 4 bleeder. So next we'll talk about treatments. There is no cure for EIPH, and there's also no unified treatment strategy that has been determined for EIPH. Treatment for EIPH only really reduces the incidence or severity of it. Again, it's not necessarily going to cure it. Some treatments commonly used include furosemide or Lasix, nasal dilator bands, nitric oxide, herbal supplements, conjugated estrogens, and omega-3 fatty acids. I will go a bit more into depth about what these various treatments are and if there's been studies done on how effective these treatments are at preventing EIPH. So the first one we will discuss is furosemide, because this is the most commonly used treatment and is typically administered 4 hours before a race. However, this is going to be dependent upon the country or jockey association if the horses can actually be given furosemide on race day, because some countries and jockey associations do not allow any medications to be given on race day whatsoever. So again, it's really going to be dependent upon where the horse is racing and if they can actually be given furosemide. Furosemide is considered a diuretic since it increases urine production. It also increases the rate of urinary chloride, sodium, and hydrogen ion excretion. According to Erickson 1992/1985, furosemide helps to reduce EIPH by constraining the exercise-induced elevation of the right atrial, pulmonary arterial, pulmonary capillary, and wedge pressures. It is also thought to redistribute pulmonary blood flow so that flow decreases to at-risk regions of the lungs, particularly the dorsal caudal region of the lungs. Several studies have concluded that administration of furosemide intravenously can help reduce the incidence of EIPH in racehorses, and I will discuss several studies in a later slide that are about administration of furosemide. However, furosemide is still questioned on whether it is actually effective against preventing the incidence of EIPH. There are other treatment options besides furosemide. Nasal dilators, also known as flare nasal strips, have been found to stabilize the nasal wall and prevent partial airway collapse to reduce EIPH incidence by 50%, according to some studies done by Holcomb and Poole. Flare nasal strips are broadly approved for use in racing in North America. In the picture on the slide, this is California Chrome. He's a pretty famous racehorse, and obviously he was wearing some nasal strips during a race in this image. Nitric oxide is another treatment option. It is a vascular smooth muscle relaxing factor that is produced endogenously. In a study done by Mills et al. 1996, inhaled nitric oxide reduced pulmonary artery pressure during exercise, but it simultaneously increased EIPH incidence. Based on this study, it just sounds like this may not be the best treatment option if it's really going to increase EIPH incidence. Another option is omega-3 fatty acids. In a study done by Portier et al. 2006, diets rich in EPA and DHA were found to improve hemodynamics, which helped to reduce EIPH. And as we learned in some nutrition classes, omega-3 fatty acids are typically high in EPA and DHA. So the other option is herbal supplements. There are a variety of herbal supplements available on the market for a variety of uses. However, there are very few studies that have been done to show evidence that these can actually help reduce the incidence or severity of EIPH. Finally, another option is conjugated estrogens. There is no scientific evidence that conjugated estrogens are effective. However, the use of conjugated estrogens and antifibrinolytics is widespread throughout the racing industry. I thought this was interesting because obviously there hasn't been scientific evidence that these actually work, but it sounds like it is widespread and being used throughout the industry. Now I will discuss some various research studies I found interesting done on EIPH. So Hincliffe et al. 2009, they raced thoroughbreds and administered saline or furosemide 4 hours before a race. Their results showed that horses were 3.3 to 4.4 times as likely to have an EIPH score greater than 1 and 6.9 to 11 times as likely to have an EIPH score greater than 2 when administered saline versus furosemide. So my conclusion of this study is that furosemide helped to reduce those EIPH scores and the likelihood of having an EIPH score that was higher than 1 or 2. Pagan et al. In 2014 did a study about mineral bounce with furosemide. Their objective was to determine mineral loss after furosemide was administered. Furosemide negatively affected calcium bounce 72 hours after administration of the furosemide. So to me, this study I think is really interesting because furosemide is a diuretic. So clearly it is affecting the horse's, mineral bounce if they are administered furosemide. Gold et al. In 2018 did a study with barrel racing horses. I thought this one was interesting to include because EIPH can occur in barrel racing horses. Basically, they went around to various barrel racing events within the Pacific Northwest to determine if a relationship exists between performance and EIPH in these horses. They utilized both the BAL test and endoscopic exams, and they found that there's no correlation between performance and EIPH score. The BAL RBC count or treatment with medications for BAL RBC count and TBE EIPH score. Costa et al. 2006 did a study on thoroughbred racing horses in Brazil. I believe they only utilized horses that were confirmed bleeders, so confirmed that they have had EIPH before. And these horses showed higher risks of EIPH in the winter and in longer races. Then finally, Kinch et al. 2017 is the article we'll be discussing on Moodle. The title of it is Effectiveness of Furosemide in Attenuating Exercise-Induced Pulmonary Hemorrhage in Horses when Administered at 4 and 24 hours prior to high-speed training. I thought this article is really interesting because it's getting at whether we could push furosemide administration out to 24 hours prior to racing. So those jockey administrations or those countries that don't allow medication to be administered on race day could potentially use the furosemide just farther out before the race. So again, stay tuned for that article because we will be discussing that on Moodle. Then here are all my references that I mentioned throughout this presentation. Thank you so much for listening. I hope you guys learned a little bit more about EIPH within our horses. And please let me know if you have any questions. I also look forward to discussing the Kinch article on Moodle with you all.